think we have. Of the picture from February 15th.
Not to interrupt, but none of us on Zoom can hear you.
Oh, can you hear me now better if I speak up?
Yes.
Yes.
I'm speaking pretty loud here. So anyway, see where are those notes? I'll have to look at them. So there was a motion on the floor to approve this draft ordinance. And then there was a motion to table. It was tabled and there was a roll call vote. So the way it appears in the minutes, it looks like the roll call vote was on the motion, but the roll call vote was on tabling. And so I just think that the order there should be, where it lists the roll call vote needs to be brought down in the minutes below the motion to table. Because the original motion would still be in order when we bring it up today. So when it comes up today, we'll be initially discussing the original proposal. And if we're going to adopt a change in it, we'll have to amend that original proposal as we take it up. But anyway, on the minutes, I just think the roll call vote should be listed underneath the motion to table, not underneath the original motion, because the original motion was not approved as it stood.
Yeah, yeah. Oh, yeah. Yeah, it does look like we approved the ordinance.
Which we did not.
Yeah, yeah,
That should be down one.
yep,
Yeah.
yep.
Okay. All right, we'll make those changes. Yeah. This
done here. Yeah.
Okay, because this is the motion to pass, did not, it just.
Hasn't-
Then we had the motion to table. Yeah.
And then this one, we'll put that in. Okay,
Any other additions or corrections that anyone noted?
I would think, I just want to look back at what we were just discussing here, and I think all you really would have to do is delete those two sentences underneath the square of, El Negro made a motion, and just get rid of that discussion pursued. And then roll call, because then it clearly says below there that, it was tabled. What makes it look like we were voting on the motion is that roll call was requested for this motion.
but the roll call was for to table.
Or tabling,
For
yeah.
tabling it,
So
and that's what I'm
we need to-
saying, if you can get rid of that, those two, however you want to do it, it doesn't
Yeah.
matter.
Yeah, we'll just.
I think it would
move
move that,
up
yeah.
in front
Just
of
bring
the
it
roll
down,
call.
yeah.
Yep.
Okay.
Any other additions or corrections? Otherwise, we need a motion to approve the minutes as amended.
George, you say move to approve the minutes as amended?
Laura Cruz, I second.
Okay, a motion by George, seconded by Laura Cruz to approve the minutes of the last meeting as amended. All in favor signify by saying aye.
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 Opposed? Motion carries. 2022 end of year expenditures. Amber?
Hi, sorry, I was trying to unmute myself. Can you guys hear me?
Yep.
Okay. So, this last hour I sent Lisa the wrong report. So I don't know which one you guys have in front of you, but I'm gonna share my screen. What's that?
We've got the right one. Yeah,
The one that's dated 4/19?
Well, it's dated 4/13, but it's a different numbers.
It's
It's
the
the
latest
numbers
one.
you're talking on the phone.
Okay, so here's a real brief of the fun that I had. So last week I sent you the report. Today, this afternoon, I just kind of reviewed it. I did find an error where I was missing some MA. So I corrected it and then I sent a report to update it. And then I sent the report from February that you guys had. So if you guys are looking at one where I think it's like 122,000, the date got changed on that we were under, but if you, I will put this out there, Lisa can put it out there, but if you guys, can you see this on the screen? And it has the date of 4/19. This is the report where we are as of today. So this is the one I want to use. Which still looks better than the first one that I sent you because I had missed some MA. Is that,
Somebody good?
okay, so real brief, I'll just looking over it where we're at. This is not final. We have our audit. Their auditors are coming next month and there's still been a few things coming in. Small amount, so I don't anticipate changing some, but it could still change. And I will, if there is some changes, I'll present another final one in June when we get together again. But looking at it overall, compared to our levy, we're about 85,000 over the levy. And then let's go down. Everybody, looking at the different departments, they're all, for the most part, under the levy amounts. And then we just have one department, and we all know those reasons that are why for that one. But our main culprit here is the children's and family. With the placements, that's where we went over on our budget here. So you'll see our big 500,000 over what we budgeted there. We don't have any choice to pay it or any control over it. So that's what changed it. But then where we got lucky is that our other departments did come in under, public health came under, again, I believe that has a lot to do with our COVID grant. So that was a couple $100,000 under, which then overall puts us at about 85,000 over our budgeted levy at this point. I don't anticipate too much changing, but there still could be some. Does anyone have any questions on this report?
George?
Yeah, I have a stupid question. I don't know what you mean by the word levy. You've got, on the line, you've got levy and then you've got actual, budget, and variance. What does levy mean?
Those
So-
are the tax dollars that we.
Are the tax dollars the actual, the budget, or the variance?
The actual is where we're currently at. The budget is what we projected to be at. And then the variance is the difference between the two. So right now, we're showing a little bit over.
But you're saying the levy isn't any specific number. It just refers to the
No.
budget.
No.
The actual budgeted number is 2,333,125. That's
Yeah.
what we projected, that we would be at the end of the year.
On my end of the meeting.
We can hear you, Dr. Keller.
Okay, great. Thank you very much.
The levy amount, though, simply is the amount of money that comes from our taxes.
Dollars.
It doesn't include any of the other subsidies or any other funding sources. It's just the dollars that are budgeted towards health and human services that come directly from the county's
Okay,
tax.
so you say tax dollars actual, tax dollars budget, tax dollars variance.
Actually, what was spent.
Yeah.
And budgeted was what was set up in our budget. And then the variance is the difference between the two.
Thank you.
Thank you. Any other questions on that? So since, if there's no questions on that, I just wanted to give a real brief update of some of the changes and stuff we've been working on in our department. I am hoping we might see some changes in our reporting here in the future. I'm trying to set everything up so we're all on the more detail and everything's all on one accounting system. in Springbrook. So we're working on that, and we also have a new, CCS might talk about later, but they have a new electronic system coming in, so we're working on that and replacing. So we have a lot of stuff in the works this year, and we'll see some changes and trying to make things better, easier for reporting and understand. So I might try some different things over the next 6 months if you see it, and appreciate any feedback. And if there's anything that you like to see different, anything now, that just feel free to let me know, and I can try to incorporate it for the future reports.
George has a question.
George has another double question. So are grants tax dollars?
No,
No,
Then
No.
why are they part of levy? I just
No,
don't
they're
understand
not.
the terminology at all.
They're part of revenue.
no, they're part of, this is all revenue
I
sources.
understand that, yeah. But,
so the levy is highlighted because that's what the bottom line is.
okay,
You know, that's,
See, if you look,
we try to come
the
under.
total revenue is down here. And of that 9 million,
thank
only
you for-
2 million is
okay.
tax dollars.
Thank you,
Everything else coming from grants or.
I got it. Thank you.
Amber, this is Matt McKenzie. What I would really appreciate seeing as a summary on any of this financial stuff would be anything that wasn't budgeted, you know, that's unexpected, so that we have an idea of what that is. If it's budgeted, it's, you know, my opinion is that we've talked about it in the budget process, and as long as you're spending money from that, that's as it should be. It's the unexpected stuff that I'd like to be made aware of when we make approvals.
So those are almost exclusively our out of home
I
placements.
was just gonna say,
in
like
children's
the out of home placements and things like that, which
Mhm.
we have no
And we-
control over.
We can give you the breakdown of what that was, but if we scroll down, if Amber can scroll down to the children's services. Then that'll break it down a little more clearly for you. So we're $500,000 over in levy for children's, and that's exclusively because of our out of home care. We have one youth who's in Pennsylvania, and it's
$22,000 a month.
for one child.
But luckily,
Unfortunately, we have a lot of children.
we have changed venue on that case and we're almost done paying, so.
No, you jinxed us.
Any other
Amber.
questions?
Yeah, Amber, can you just please upload this document to the website under today's meeting?
Yes, yep, this just kind of found out that I had sent the wrong one like 15 minutes before the meeting. So Lisa didn't get a chance to get this one up there, but we will definitely make sure this corrected one gets replaced with the one that's on there.
All right, thank you.
Mhm.
Any other questions or about the budget? Before we move on, we need to wish Dr. Keller a happy birthday. I understand.
Did it jump up?
Happy birthday, Dr. Keller.
Happy birthday.
Happy birthday.
Happy birthday.
We're not gonna sing though.
That would be a public health problem.
We'll move on to public health update.
All right, so I have just a couple of updates on some things that we have been working on. One of the pertinent issues that we're looking at right now, just related to seasonal with the amount of snow that we've had, and the rain expected and the frost and everything like that. We are already seeing flooding, this year, as everybody is aware. And flooding in places, I've seen flooding in I'm just thinking the Glidden area specifically because that's, you know, where I grew up, so I'm kind of familiar with where the floodwaters go there. And I'm seeing flooding in places that I haven't seen in 25 years. So we're concerned regarding some of the private well water systems and the potential for those wells to become contaminated due to the flood runoff. So what we're looking at doing is offering reduced cost for private citizens for their wells if there's a concern that their water may have become contaminated. Typically, our bacterial testing is at $25, but for individuals that have the potential for floodwater exposure, we're looking at running those at $10 rather than the normal $25, and we would leave that open for a period of time, approximately about a month or so, depending on how long it takes for the floodwaters to recede, the severity of the flooding. Hopefully Mother Nature will be kind to us here coming up in the future. Going along with that, I've been in discussions with our GIS department. She has on the county website, there's the map that displays which roads are closed related to flooding or whatever's going on with the road conditions. So this part of it would not be public facing because we're not going to give out individual addresses, but it would be a data collection source for us that we would then be able to potentially utilize later down the road, where we would be able to see which private residences were exposed to the flooding, if their well water came back contaminated, treatment, that sort of thing. So just kind of more of the data collection aspect of it would be that part of it that we would be able to utilize down the road. Then, you know, if there would be grant opportunities or something that would come up. The DNR does have some grants going on right now as far as well replacements or system updates and things like that. So there might be some correlation with that at some point in time. But we are looking at doing that, and hopefully we'll have information available in local newspapers regarding that. So community members will be able to utilize that coming up. And then for a COVID update, there has recently been new information regarding the COVID-19 vaccines. Just recently released, the FDA has authorized changes to simplify the use of the bivalent vaccines. So once this is all approved, the monovalent or the original COVID-19 vaccines will no longer be available for use. The FDA is intending to make a final decision about future vaccinations after receiving recommendations on the fall strain composition. And that will happen at an FDA advisory committee meeting coming up in June. What that equates to is essentially looking at a seasonal COVID-19 booster, similar to what we do for flu shots. So it'll be an annual booster that will be recommended based on the circulating strain. In the meantime, until that all gets approved, ACIP was having a meeting on it today. So once the ACI approves the recommendation, then DHS will have to adopt those, and then we'll be able to start administering those vaccines to eligible individuals once that's all finalized. We are anticipating a vaccine vacation coming up. With the unwinding of the public health emergency, the local hub distribution points, there are 4 of them left in the state, ours coming out of Eau Claire as it's the closest to us. Those hubs will actually be closing. So right now, the minimum order of vaccines that we can place is 30 doses. Once those hubs close, it'll have to be a direct ship from the company, and the minimum amount of doses will then be 100 doses. So we're concerned about the possibility of significant vaccine wastage. So once those hubs close, we will be looking at not ordering any vaccine until the fall, once the recommendations come out for what the annual vaccines will be. So we might have a bit of a vacation from COVID vaccines just over the summer months. It will still be available locally at our pharmacies and potentially in doctors' offices, because they do have, like the clinics have the storage capability to keep the vaccines in the deep freeze. We do not have the deep freeze storage capability, so we want to avoid the vaccine wastage. Otherwise, as far as case activity, the month of March, there were 31 lab confirmed cases. These are only the lab confirmed cases, so it doesn't account for home testing or the guilty by association. So if you're living with someone who's positive and you're positive because you have the same symptoms, that sort of thing. The month of April, we've had 14 confirmed cases so far. There might be, schools are reporting a possible uptick in activity right now. The Ashland School District did make a note this morning that they might be seeing a few more cases than what they had in previous weeks. But those are predominantly home tests, so it won't necessarily reflect in our numbers that there's an increase in activity. And that's kind of the nuts and bolts for COVID right now. It's still out there, but the numbers are significantly lower than what they had been, is kind of the bottom line. Quick update for our Narcan. We did renew our contract as a Narcan direct provider. Throughout the month of March, we provided Narcan training to the Ashland School District. We had 24 staff members that were trained for use of Narcan in their emergency kits. And we are working on a system so that children or staff members, whoever it might be, if they were to need Narcan outside of an emergency situation in the school, they would be able to contact us and we could deliver that to the school for them then. And we are working on scheduling with the Mellon School District for Narcan training for emergency use as well. And then the last thing I had for an update is that the mobile mammogram unit, we partnered with the Wisconsin Well Women Program and Marshfield Clinics again. So the mobile unit will be in Glidden tomorrow, actually, at the Marion Park from 10 a.m. to 3 p.m. So we've had that information out for a while. So I know last year there were, I think it was 3 individuals that utilized the service. 2 of the 3, it was their first time ever receiving a mammogram and they would not have received it otherwise. So definitely filling that gap in service there. So we're hoping for a good turnout this year as well. I know 3 doesn't seem like a significant number, but there are only 10 appointments available given the space that they have to work with the unit. So 3 is a pretty good number for that regardless. So any questions on that?
Matt?
I'd just like to compliment you on having the foresight to look at wells with the flooding issue. And I think that's something that, you know, Dan, I know Dan was on here, something we should look at. If there's something we could do to provide free testing to questionable wells, because what it is, obviously, if you get a flow down there, it could contaminate the whole aquifer, not just that one house. And I think it would be great if we could offer a free test to those of concern. Maybe land conservation could even help identify the problem areas.
And I did reach out, but I haven't heard back from them as to what they might have available. So it's still a lot of moving parts with it, but the initial idea is taking shape.
I think it was an excellent call, and whatever we can do to support people testing it, better safe than sorry. It has such wide reaching implications if it does get down in there.
Yeah.
More than just that one home. So thank you.
Rich?
I was gonna ask you about, isn't there a new COVID variant right now that's available, the newer version of it?
The bivalent one is the one that's currently on the market.
Okay, how new is that? That's pretty new,
September.
Yeah,
September it was?
Well, there's an announcement today, right, in the news.
yep, the FDA approved it, but ACIP has to give the recommendation and then we have to wait for DHS to adopt it. So we have to, it's the trickle down effect for the paperwork is what we're waiting for at this point in time, basically.
But that'll be a while then, like you said.
They usually have a pretty quick turnaround. It could be as early as next week.
Oh,
That will
'cause
have
that's what I was
the
gonna say. I was talking to people, they say within 2 weeks they're gonna get a shot for the new COVID.
Yep.
So, okay, thanks.
Any other questions for Liz? Then we'll move on to number 6, Human Services Day at the Capitol.
So last Tuesday, 3 of us, myself, Jerry Esla, and Natasha McFadden, drove down to Madison to meet with our new legislators. It's about a 5.5-hour drive, so we left on Tuesday, stayed overnight and met with them on Wednesday. With Bayfield County and a representative of Barron County. Every year, they do have this day just for human services to be able to target what human services would like to focus on, and issue papers are determined by the Wisconsin County Association in conjunction with the Human Services Association. So the papers are attached to this, but just in brief, they focused on mental health, specifically our community support program and crisis services, which they are advocating that they be funded 100% like they have done in the past with our comprehensive community services program. It is almost a preventative thing to keep people out of hospitalizations and institutions, so we are hoping that they will take a look at that for us. Adult Protective Services, as you know, we are an aging population, and we have seen dramatic increases in the amount of reports and investigations that we have to do. We've had one person in that program for 20+ years, and she's seen her caseloads double and triple, and we almost lost her. She was going to retire until we shifted around some services because it's just too overwhelming. So we are really advocating that they provide more funding for that area. We know with the aging population that it's just going to continuously increase. And then child support funding was something that was voted on by the membership as wanting to specifically request more funding, as they have taken away some funding in the past for birth costs. And they are looking at, and this is really what we wanted to plant the seed with our legislators, is there's some motion out there really trying to say that it goes against the ability for parents to reunite with children and who have been placed in out-of-home care if they are not still receiving child support. So currently, when a child is placed in out-of-home care, we make a referral to child support, and instead of that payment going to the custodial parent, it goes to pay for part of their out-of-home care costs. 10+ years ago, Wisconsin, and I don't remember which private entity it was, but they did a study that showed that it can, by doing this and not having that custodial parent have that funding, that it can delay reunification. And what we wanted to point out was the world of child protection from 10 years ago to today is totally different. And Jerry knows all about this, but what is delaying our reunification is heroin use, meth use, fentanyl use. Those are what is not going to be affected by whether or not a parent gets child support. The flip side of that is if you're the non-custodial parent, it's a little irritating for them to see it going to a custodial parent who doesn't have custody of the child. And, you know, there's a flip side of that also. For some cases, it could affect whether they can keep their housing, you know, that housing stability is huge. So we are advocating that they let us make those decisions. We know the parents that we're working with. We know the cases, we know the issues that are affecting why children aren't being reunified. And so that was a big thing for us as well. And then the fourth focus was on birth to 3 funding, which I thought they were extremely interested in. So birth to 3 funding is an entitlement for any youth who is behind in their milestones and meeting the milestones per their age to really get intensive services while they're young, to catch them up and get them to the milestones that they're supposed to be at. It is very early intervention, and you know, it's a really good investment in our youth. And a lot of children who receive birth to 3 services go on to not require continued services because they've received them so early. So those were the 4 focus areas. I thought our new legislators were very engaged, receptive. They were taking notes. They were asking questions. I thought it was a really good experience, and Jerry was there as well, and Tasha was too. So if you want to add anything, but it was, I thought it was worth the trip.
Absolutely. And, you know, Terry mentioned the 4 pages of talking points that we got from the Wisconsin Counties Association. And of course, I did my own thing, but
there was another piece of the governor's budget that I wanted to make sure that got talked about. And that is the kin-like program that the governor is proposing to fund at the tune of $16 million. Which would expand not necessarily the legal definition of a relative, but at least what the qualification as a relative would be in terms of the kinship care program. Which would be a huge help to us because we'd be bringing in a whole bunch more individuals that were not qualified to receive kinship care previously for caring for a relative. This would also include people that they consider to be like kin, that had a substantial emotional relationship with the child or the family prior to the removal. And another big chunk of that $16 million would go to increase the monthly rates for care for kinship care kids. It will also stratify it according to age, like foster care has been forever. Kinship care has always been a flat rate per kid. And it's a really low, I mean, it's $300 a month and you can't feed a kid for $300 a month. So, I wanted to make sure I snuck that in as we were going out the door. That would be a huge benefit to my unit and the county as a whole. It would save us a lot of money.
Anything to add, Tasha?
Nothing in particular, but I agree. It felt like they were really listening, and like you said, they were taking notes, they were asking questions. It felt like it was a really good conversation. So hopefully some of what we said and follows through.
I have to say, I was also very tempted to make some sort of lettuce joke with romaine, but I didn't do it. I did not go there.
Any questions? Otherwise, we'll move on to staffing updates.
Okay, so this won't take too long. Just a few updates. We have hired Rebecca Pup. She is our children's long-term support and coordinated services team position who replaces Tia Smith. We have Jessica Tapany starting this Thursday, tomorrow morning. And she is replacing Sue Miller, who moved to Florida, who was our family services worker. So we're very excited about that. We made a job offer today and it was accepted to Christine Sturtz. She will be our economic support worker, replacing Heidi Hagan. And we are still interviewing for one position in the children's long-term care and coordinated services team. And we had one today and we have one hopefully on Tuesday. It hasn't been confirmed, but we have some good candidates, so we're hoping to be able to fill that quickly. And that's it.
Okay. Now we come to the communicable disease ordinance.
All right, so the new and improved. Not really. There were a few edits made, mostly for clarification. So we did, I was able to kind of go over a little bit more with a fine-tooth comb with court counsel. So you have the edited version, so you can actually, it's still got the red strike throughs and things like that, so you can see what was edited and where things were changed at. And then the rationale for moving them. So section 7B, and I don't know what page that's on, because I don't have page numbers on it.
There are no page numbers on here.
Oh, second to last page.
Yeah.
So on section 7B, because paragraph 8 already sets the penalties for violating a written order, the penalties were removed from paragraph 7, because then that helps to clarify, and it provides a distinction between the written order and an enforcement action. And then the clarification between enforcement action and a written order helps to provide clarity to the appeal process in paragraph 9. Paragraph 9 was revised to clarify that appeals to the board are only of public health orders and not appeals of enforcement actions. He also added a section that any enforcement action commenced for violating an order of the public health officer should be stayed until the board has made a determination on the validity of the order. So I know that was part of the question last time was regarding the enforcement and appeal process. So this hopefully helps to clarify what those questions were from last time then.
George?
Okay, so section 9C sort of scratched my itch about regarding due process, because it stays the action as soon as the person appeals it. And it puts the onus on us to resolve the situation as quickly as possible, because otherwise the person might remain in non-compliance, right? But I have something I don't quite understand about this. So when there's an appeal, the order itself is not stayed, as I read this. What is stayed is any enforcement of the order. And so my quandary is, suppose there's the gray area one where we think for the interest of public health, it has to be ordered and the person appeals. So they don't want to be in quarantine or some other situation. And 10 days later, we were able to pull the board together and we have a meeting. And well, if we honor the appeal, we decide that the party was correct and the order was not an order, it's just finished. But if they've been in non-compliance for 10 days during this period of appeal, and we decide that the order was correct, and they should have obeyed the order, then are they fined minimally $100 a day for those 10 days? Because the enforcement was stayed, but now the enforcement is enforced, and then they've been out of compliance with the order has been sustained, and they've been out of compliance with this order for 10 days because they were appealing and they decided they didn't have to conform to the order. And now, do they or do they not owe at least $1,000 and maybe $5,000? It's all about how this reads.
Yeah.
And it seems to put them at risk.
But I believe when they stay an order, that there's no action taken during that period of time that an order is stayed.
Right. But then when the stay is lifted,
It would
And
be
this-
from that point forward.
and the order itself has been confirmed, the order itself was never stayed. It was in effect on day one. It was never stayed. Only enforcement of the order was stayed. Right? So now the stay has been lifted. And the ordinance reads that they're subject to $100 a day minimum and a maximum of $500 a day, and it is on a per day basis. So maybe that's okay. Maybe that compels them to stay in compliance until their appeal is heard. I mean, I'm not objecting to it necessarily, but I think we need to be clear on whether this wording means that they would be subject to the fine if after 10 days their appeal was denied.
Yeah.
Question raised with me, and I don't know how to resolve it.
I mean, 8B says that it's a violation that occurs on a separate day if they continue with the offense, but it's been stayed. So I think they violate this, enforcement action comes to them, they appeal it, that's like 1 day. And then the next however many days us like getting together, I don't think they get subsequent days. It would seem that the enforcement action is stayed, and so then they got it for Monday, and the next 9 days, they didn't get enforcement action, it's on hold. I'm not a lawyer.
No, I'm saying it's ambiguous.
No, but 7A2. And that's under enforcement. So if you're staying the enforcement, the time period in which the violation must be corrected or abated, usually 1 to 5 days or 10 to 30 days. So that would be stayed.
Right.
To
Yeah.
me, this whole thing is problematic. I mean, and for the most part, if somebody says that, I want to appeal this, it's as if nothing happened. And, by the time we could get together and make a decision, the purpose of it ideally would be gone, especially if it's only 5 days.
Yeah.
I think if we're gonna do something like this, we should spell out that the board needs to meet within 48 hours or something to make a decision. And to me, I would think we'd want to do the reverse and say that it's not stayed. It's in effect for 48 hours, and maybe do it that way to say, hey, you got 48 hours for the board to meet, otherwise it'll be stayed. If we can't gather and make a decision on their appeal within 48 hours, then, it would be stayed but, obviously if this is something severe enough and you wouldn't be taking this action if it wasn't, I don't think we should overlook it and just say, oh, okay, they appealed. So therefore it stayed and,
Yeah.
the clock is still running and they're out of the woods, period.
Okay, if you look at, 8. B. A separate offense shall be deemed committed each day during or on which a violation occurs or continues. The violation occurred on the day of the order. And therefore it doesn't, and so enforcement of the penalty until the appeal has been heard, I can understand. But I don't, if the appeal is rejected, this reads to me that a fine needs to be imposed.
Yeah, what would be an example of where you could possibly see this being used?
Tuberculosis, measles.
Okay, so a person comes down with measles and you give them an order to, quarantine, and they tell you, no, they're not gonna do it. Then does it become, they got measles, you can't get, I guess you can give them twice now because they call it shingles, don't they?
No, that's
chickenpox.
Okay, yeah. That's why they got you.
Chickenpox.
But I guess what I'm saying is you got measles, it's like, if you're not getting it again the second day, you have it. So I don't know, it just.
So on 9C. So. Pending enforcement action under paragraph 8 relating to the order shall be stayed. So the order itself stands, but the enforcement, so the fine
And any separate offenses.
is stayed. So the person needs to quarantine.
And you'd
But I
be charging them if they don't do that.
I totally agree with what you're saying about making the time shorter for the appeal process. I think it's in everybody's and the public health's interest
Yeah.
to shorten that up.
And to me, that would put it on us, if you will, just say, hey, if there's a violation, you gotta do this. If you wanna appeal it, you still have to do it for 48 hours. Or, until ordered by the board, which puts it on us to meet and make a decision within that time frame, or it stayed.
George.
Yeah, I think this wording compels us to act as quickly as
Yeah.
possible because we do want the order enforced.
Mhm.
And we can't enforce it until we meet. So this wording actually makes me feel comfortable that the board will meet as quickly as possible. Because the health officer is gonna say, hey, you guys, we've got a problem here. This person's dangerous and not compliant. We gotta meet so we can compel enforcement. So I'm not worried about us meeting quickly now. I'm just wondering whether this fine is imposed or not, because it says it must be. The court imposed forfeiture. Or they're subject to legal action. We won't have to take the legal action, I guess, right?
Right, the legal action wouldn't be up to the board. If somebody were to be in violation of the order, that would be something that we would refer to court counsel that would then go that would move into the court system, then that would be up to them to make that determination.
Okay, so we don't, the fine is not automatic.
No.
Because this just says legal action, you're subject to legal action, but not necessarily going to be compelled by this particular legal action.
Correct.
Okay, so I'm happier now.
To me, this is not about the fine. It's about compelling somebody to stay quarantined.
Mhm.
I mean, because I can recall there was a situation where it was a nurse that had gone to Africa and came back and was, supposedly had Ebola. And basically told their local community, I don't care. And, went about and did whatever she wanted to do. And they had to go through the process of trying to compel her to do that. And to me, that's the importance of this ordinance, is having the ability to say, no, you're gonna stay at home. Or some other place. If if they, as far as the money part of it, I don't care. I mean, that's up to the courts and they can figure that out if they want to punish them some way that way. But for us, it's how do we guarantee or get them to quarantine? And people, let's be honest, they're getting more defiant and gonna do what they're gonna do and, make me. So.
Yeah, I guess I'm still a little bit unhappy because the wording bothers me. That if we did seek to impose the fine, I think it may be a good idea because it compels them to want to come to appeal as quickly as possible as well. But they might point at the ordinance and say, and create an argument about whether or not the fine is imposable or not. Because what does it mean for the enforcement to be stayed? Does it mean that the fine can't be imposed at all during that appeal period? Or does it mean the fine can only be imposed after the appeal is ruled on? I think it's an ambiguity that maybe in one of 100 cases might create a problem, because the party who's being compelled by the order might say, you can't give me that fine because it was stayed until the appeal.
Well, the way it's written now, the fine is stayed during the time that the order is made. The fine, it's
The
under,
question is, what does it mean to be stayed?
it's not gonna be imposed. It's like it never happened.
Okay.
So no action can be taken during the stay.
And then when the appeal is ruled upon, the stay is lifted
Then it's lifted and
then
it goes
they-
from then forward,
Then they can be fined.
all the way back to
No,
the order
moving
date or from the appeal date.
from the time the stay is lifted, moving forward.
And then
One, I'm sure that would be up to court counsel to make that determination then too as well, as far as the severity of, what they did or,
Right.
what the specific situation was. This is,
But the way it's written now.
Yeah.
All of the penalties during the stay, during the time the order is stayed, the penalties are stayed as well. And they aren't retroactive. So when the stay is lifted, so the appeal is either yay or nay, from that point forward. If the stay is lifted and they proceed with it, from that point forward, enforcement would start. The way this is currently written.
So the party under the subject of the order would not have a complaint, because we would never have tried to impose the penalty retroactive to the date of the order.
Correct.
But I think we should try.
With the amount of work our corporation counsel has, there's no way.
Okay.
I'd like to see us add a provision in here that we can also, in this appeal, if we're successful with, our argument that it should be imposed, that they pay the damages, the cost of staff time and for the board to meet. Obviously, if they're successful and we agree, hey, there's no reason for this order, but if we confirm that it is a valid order and it should be used or enforced, whatever word you want to use, there should be some cost to that process to that person.
We can check with corporation counsel and see if that's allowable.
I thought that was in there actually, that they would be responsible for any costs incurred.
Cause you start looking at getting a board together, you
That's
know,
true.
that's
That
it's
adds
not a
up
free
quickly.
thing.
Mhm.
And it creates additional staff time as well to develop the packet for it.
George,
So Matt, you're saying that's only if they lose the appeal. would you
Well,
incur
if
those?
they're successful in their appeals and show that this wasn't a valid order, and there was no need for that order, they don't pay. Because they were correct.
So then, if they lose the appeal, imposing these fines. Back retroactive to the day of the order is a proxy for achieving the same thing, but it's better quantified.
What the difference is that the fines or forfeitures, in this case forfeitures, would go to the courts, whereas if you ask for damages, it would go back to wherever. It would go back to the budget of Health and Human Services to cover the cost of gathering of the board and, if there's additional staff time, what's reasonable.
Would that be your recommendation?
That would be my recommendation, is to include a provision in there for damages.
That seems awfully vague and hard to quantify.
Oh, they do it all the time.
I was gonna say, I know, just as an example for human health hazard orders, for the rare occasion that we do have to actually write an abatement order, that is something that is included in the order as far as under the penalty, so like in section 7 for enforcement, for under section A, a written order, for the things that it has to include, the penalty or penalties, the violator will be subject to if the apparent violation is not abated or corrected. That's something that we build into, like I said, as an example, the human health hazard ordinance, that any court costs that would be incurred or staff time associated, that they would be responsible for that as well. Which is maybe why I was thinking it was in here, is because
And
that's,
that's what I'm saying, we should
built
have it,
into it.
yeah, have it in there. And you're right, the legal time,
any other questions? Comments?
It's a little typo, 5K personal instead of person, I think. No person may interfere instead of no personal.
Yeah.
I also noted under number 7, since B has been stricken, then C should be changed to B.
Yeah.
Any other questions or comments? We need a motion on this then to approve it with that addition.
I think it has to come back. to The next meeting. Be written.
Well, we have to check with Corporation Council to see if we can do that,
Okay.
just
Yeah.
to be sure.
But we tabled it.
Well, we could just not take any action on it.
Yeah.
It's basically the same as tabling it.
We'll bring it back next time.
All right. Unit updates, adult services.
This is Tasha. Can everybody hear me okay?
Yeah.
Just wanting to give a brief update with the public health emergency ending. Many of the programs in the adult unit have had waivers and variances during the public health emergency, particularly with face-to-face visits and in-person visits. And all of those waivers are coming to an end. For some of the programs, they are May 1st, and for others, it's June 1st. But so with like Adult Protective Services and the Aging and Disability Resource Center, the staff will need to return to meeting with individuals to complete Watts reviews and long-term care functional screens, options counseling, many of the various job duties they've been able to do over Zoom or over the phone, where now they will need to go back to traveling to meet with those individuals and family members in person. Also will no longer be able to do verbal signatures, need to obtain physical signatures again. The same goes for the children's long-term support program. They've had some various flexibilities and need to return to kind of the pre-COVID rules with the in-person visits, which for all of those staff, it's significantly going to increase their drive time, their travel time, visits in person. While there's definitely a benefit to them, but they do tend to take more time than it does for those other visits. So we also anticipate for some of the programs increases in referrals that will already increase the workload. So then it'll definitely be a balancing act for when we have to then add in travel time and in-person visits also.
Okay. Children and Families, Child Advocacy Center.
Well, I have a couple of other things to start with. As Terry said, we're very excited to be fully staffed as of tomorrow. Today we were especially grateful that we're going to have a new worker tomorrow. We had, I think, 7 new Child Protective Services reports in one day, so it was a pretty crazy day. One other thing I wanted to share, I don't know if I showed you guys these before or not. I call these our permanency hands. And when workers bring a case to permanency, whether that's reunification with a parent or guardianship or termination of parental rights and adoption, I hand out a permanency hand with the initials of the child and the date of the permanence. So I've got a couple of workers that have a nice little display of permanency hands on their wall. But it's just a nice little reminder of the good work that my workers are doing, and they just go ahead and stick them up on their wall when they get their permanency hands. So we had 3 of these since our last meeting. 3 more permanency hands went up on the wall. So just wanted to share that with you. My big thing, of course, I wanted to talk about though was the Child Advocacy Center. And I'm not sure if anybody's aware of this or not, but we have had a work group going now for probably about the last year and a half, started by Amy O'Donoghue, who is the domestic abuse liaison officer for Ashland and Bayfield County. And Amy, she's getting close to retirement. I think she's just wants to run this thing by herself, but that's besides the point. But she has put together a multidisciplinary team of law enforcement, prosecutors, medical folks. We've got we got 2 SANE nurses. One is PED certified. We've got advocacy people from New Day Shelter to work with victims and getting them hooked up with services. And who else is on our team? Anyway, if I think of somebody else, I'll throw it out there. But we have a what's the word I'm looking for? Multidisciplinary team. And that also includes representatives from Bad River, and we had folks from Red Cliff come down at our last meeting. So We're including both the tribes in the area. One of the big things that we think about when we think about a child advocacy team is the ability to do forensic interviews with young children from the ages of roughly, I don't know, 4 to 12, 13, 14, depending on the child. And that is a great benefit to us to be able to have a separate entity doing those types of things. Right now, I have 2 workers that are trained in doing forensic interviews. And even, you know, when one of the workers is assigned an investigation, typically the other interviewer will do that interview for them. So they're able to just sit and take down the information. So they flip-flop back and forth. Amy is also an interviewer, but there are a number of other folks in the area that are certified interviewers that we would be able to draw upon to be able to do interviews at the Child Advocacy Center. So that's one really big thing that goes on there. But there's a number of other things in terms of being able to put together parenting groups, having some information referral, like a hub of information referral information for families to be able to seek out services on their own, or as I mentioned before, we've got the New Day Shelter folks to provide some advocacy for families. And then the other thing that I just started thinking about not that long ago is actually including like a visitation center in that facility, where folks that have maybe they have a family court order that requires supervised visitation, that we don't have a place to do that. Certainly my workers don't have the availability to take on the numbers of cases that come out of family court that require supervised visitation. We used to have a visitation center over in Bayfield that, you know, they charged however many dollars an hour and you could schedule up a visit, and, you know, one party brings the kids, the person requiring the supervised visitation paid for the visit and did it right there. We have not had something like that for a long time. And I think that this might be an opportunity to do something like that as well. And the other big thing, and I mentioned the same nurses, is the ability to have a member on the team to do medical evaluations. And oftentimes there are not a lot of there's not a lot of physical evidence in the cases that we're dealing with, especially the sex abuse cases. It's very difficult to collect physical evidence. But if there were ever a situation where that were to come up, that piece is absolutely vital in being able to prove cases. So we have this team all put together, and we actually located a building that we're really interested in. So I don't know if you remember Dr. Hickman's old office by the Neighborly there, and then Dr. Glessing went in there. Well, Dr. Glessing is retired. And they are actually interested in offloading the building. I was kind of hopeful that maybe we could look at renting the building, and the reason for that is that I've been working with the Essentia grant folks on this particular idea and some other wish list ideas I have for them. And they were actually interested in helping fund rent for a building for us to be able to do this. In further discussion with Dr. Glessing and his wife, it sounds as though they are much more interested in selling. And then he would actually like to rent back one of the rooms to be able to see a client here and there, whatever. But so it might be a moneymaker, you never know. So we're a little hung up on that right now, but it's really a thing that I'm pretty excited about. There is no child advocacy center. The closest child advocacy center to us in the state of Wisconsin is in Wausau. So when we have needed a service like that, it has been a hardship to be able to access it. But I guess I don't have an ask. I just wanted to tell you guys about it, let you know that it's out there, and we've got a team of people that are pretty dedicated to working on it. And I'm digging around little holes and pockets looking for money, and if anybody wants to pony up, we're good. But yeah, that was my thing and thanks for your time.
Jerry, quick question. If you
Yeah.
don't mind. At the police department here in Ashland, I was under the assumption that they were gonna use one of their witness rooms that doesn't get used much for something of what you're talking about for the kids and.
We have actually been utilizing, and this is really the only interview function, really well functioning interview room in Ashland right now, is that family room right off of the lobby.
Right.
And we've been doing,
So is that working? That's what I wanted to check.
it worked. It is absolutely not ideal to be dragging kids into the police department to go and do a forensic interview.
I get it, but it's better than nothing.
It is better than nothing, but the gold standard is the Child Advocacy Center. There's one in Duluth. I cannot remember the name of it off the top of my First Witness in Duluth. And I've been up there to tour that place, and it is phenomenal. And they do just amazing work. We have had kids go over there for their forensic interviews from time to time, and it's top notch.
Rich?
How much, how much remodeling would you have to do to that building to make it like you want it?
Very little.
Very
So
little? Okay.
you walk in the door, there's like a lobby, reception area, there's an office and 3 exam rooms. So basically in the office, we would have the video recording equipment. One of those other rooms would be the actual interviewing room that will be set up with the cameras, easel, comfy chairs, a couple stuffed animals, whatever. And then the other, well, apparently Dr. Gleston needs to be in there too. But, the other rooms could certainly be utilized for the advocates, a waiting area for the parents, stuff like that. And there's not much that would need to be done other than installing the equipment, which we already have.
Oh, you got the equipment already?
Yeah.
Oh, okay.
We had all our equipment in the downtown building, which got to be a problem.
Any other questions for Jerry?
Oh, one more thing before I shut down. Terry had mentioned earlier our issues with how child protection has changed so much in the last 10 years. And we were actually talking about this earlier today, that with the epidemic of especially the heroin and fentanyl being in so many other, cut into so many other drugs that people use. We are seeing a huge uptick in the number of infants that we're actually removing from the hospital, directly from the hospital right after they're born, and going into foster care. And what we see with these parents oftentimes is that they just go boop, and they're gone. There was one case that happened a year and a half ago, maybe closer to 2 years now, where we ended up removing an infant from St. Mary's up in Duluth, and did not see the parents for over a year. And these kids, we initially placed with a grandparent and moved on to an uncle later on. And even now, these parents are so hard to engage. I don't know that we really can realistically plan on having a reunification plan at this point. It's going to end up probably being a guardianship. But the numbers of infants that we're seeing so far, which I jokingly said this morning that we blame on Terry because she had a grant where she was able to buy a whole bunch of car seats. So we're ended up using them like crazy. But I believe, and I need to double check this, and I'll get back to you on it, but I believe that every new CHIPS case that we have this year, all of them are infants that we removed from the hospital after they were born drug affected.
Pretty sad.
Yeah.
Okay. Community service programs, record storage and retention.
Yeah, so the only thing we have left at that downtown building is some of our record storage. And we've looked at a number of different ways to deal with it. And basically, we don't have room at the Sanborn Avenue office, and there really is no space at the Sanborn Avenue property to bring in a storage unit or anything like that. We didn't, we had a hard time finding space to push snow this winter. So what we've come up with, Dan has talked with the city, and the city is allowing us to keep our records securely in the room in the basement where they're at, short term. And we are going to be scanning them in to a server specific for our record storage. It's a huge project. It's gonna take a huge, Rachel's found a server that's going to be able to handle this amount of scanning, and DVR has helped us find a young man to do the scanning. Northwest SEP is going to be paying their wage for 90 days. And he starts Monday. And this afternoon, Highway Department came over and delivered the first 40 boxes. So we're ready to go.
160 left to go.
Okay. Economic support.
Okay, so I just wanted to give everybody an update. With the public health emergency ending, we are actually much closer now than what we were before to resuming our healthcare renewals. So just a few updates on some actions that have been taken by DHS. The last week of March, DHS had sent out 785,000 letters to members about their renewal dates. Their renewal dates are anytime between the time period of June, so this year, June 2023 through May 2024. It's going to be about a 12-month turnover, basically, from changing cases that are continuously covered due to the public health emergency to putting them back with regular eligibility standards. So all those letters went out. Members should have gotten them already. Continuous coverage will continue until the members' scheduled renewal. So it's not like they're ending healthcare right away. They've staggered out a lot of these cases for a couple of reasons. One of the bigger ones is to stagger out the workload. So as long as the member doesn't try to complete an early renewal before their scheduled renewal date, they will maintain their continuous eligibility and coverage. Members will get the traditional 45-day notice, letting them know when their renewals are due. So that's for members who are currently, their cases are currently in our software, CWW Cares Worker Web we call that. For those who were not eligible, so before the public health emergency rules came into play, there were many individuals whose healthcare was ended for March 2020. And for those individuals, because we couldn't reestablish the healthcare in our regular software, they were actually continuously eligible within Forward Health, which is another set of software. For those members, though, their renewals or applications for benefits to continue for healthcare is going to be May 2023. So that was 80,000 members that DHS either already has or will be sending out letters to. On one positive for people who might be losing their Medicaid eligibility, FFM or the federally facilitated marketplace, they do have a special enrollment for those who did lose their Medicaid. So outside of open enrollment time periods for health insurance, members can contact the federally facilitated marketplace and look at getting private insurance with that premium tax credit that the government offers. So that is an option. And for our region, Northern Consortium has put the same message concerning the renewals on their hold messaging. So customers should be getting those messages. Any questions about the healthcare so far? Okay. We also have caretaker supplement renewals. For those of you who are not familiar with that program, that is a cash benefit for parents who are eligible for SSI. It's an additional monetary benefit to help those parents be able to care for their children. Those renewals are starting now in this month of April. So that is in play. And then the next big changes we have coming are for food share. There is a Policy regarding food share, if you are a convicted drug felon in the last 5 years, typically we would drug test those individuals. With the public health emergency, that particular policy was suspended. It is going to be reinstated very soon. We're basically just waiting for some information from FNS. And once that is completed, then there should be some type of operations memo released from DHS. We're expecting it at the end of this month, telling us exactly how we're going to be testing. Ashland County, I want to say, has about 36 individuals so far who would be affected. And then the other change is going to be student eligibility. With the public health emergency, there was a little bit of an expansion on student eligibility rules, allowing more people to be eligible for food share benefits during the public health emergency. Those rules are also going to be restricted again. So back to the original rules that were going on prior to the public health emergency. And that one, we don't quite have a date for, but it's going to be around 30 days after the public health emergency actually ends. So those are my updates. Any questions?
This is Matt McKenzie. One question I have is, are we still doing like the fuel assistance and furnace replacement and how that went this winter? If we are, you could give us a rundown on that, I would appreciate it.
Yep, we are still completing those. In fact, we've had some recent disconnects. So we've had a lot of phone calls on that. I do believe that I put in a document on that. I'm just trying to find it.
No. Page 1 of 2.
Yeah, it's very.
It's in the written materials.
Yeah, it should be in the written materials.
So did I get bottom line? Did we have enough money?
Yes.
Okay.
Yes, we've had about 814 households apply for energy assistance. And it looks like we've had a pretty good amount that have been paid. There's the few denials we've had are usually due to either signatures not being completed or verification not being returned. There maybe have been a couple where folks have applied, but they simply were not non-financially eligible, meaning that perhaps they already had housing. So their heating and electric was already being subsidized. But yes, we've been doing fairly well there.
Don't the shut-offs normally start right about now? And, you know, with the colder weather, has that been extended at all?
That has not been extended. Bayfield Electric and Price Electric are two companies that I know have already begun their disconnects. We do have crisis funding available for some individuals if they need it. And of course, again, depending on their circumstances. So we have been getting quite a few phone calls on that as well. Our usual week worker is out this week, but her backup has been fielding all of that fantastically.
Thank you.
Any other questions for Amy? Otherwise, we'll move on to written materials.
Sorry to interrupt, Dr. Keller needs to be excused, so I can get to his birthday dinner.
Okay, well.
I told us that I end with chocolate cake covered with chocolate frosting, so next time we meet, I may have this.
You won't be able to make the motion to adjourn today then.
Good luck with those candles.
Happy birthday.
Okay, any particular items in the written reports that any of the supervisors want to particularly bring to our attention?
I think they're pretty similar to all the other written materials we've generally did. The only thing I included differently this time was just the biennial budget summary. That was a compilation that the Wisconsin Counties Association put together of the governor's proposed budget. That's just a proposal. You know, last time we kind of gutted it and started over. So you can see what was proposed and some of which are things that we did advocate for. So.
As I was flipping through here, I noticed that the intercounty agreement on venue. In chips and delinquency cases is in here. Was that part of the WIXA?
That's part of the Wixom meeting.
Yeah. So this is kind of an interesting read. There have been, I mean, for the last 31 years I've been here, counties have been interpreting venue differently for all of that time. And you might find it hard to believe, but there's some significant arguments that occur over whose case it is. This has been in place now for 12-ish years. And it's a godsend, because all the counties sign off on it. And when we get into a scuffle over whose case it is, I say, well, on page 4, paragraph blah blah, and you get right down to it, and there's no argument. So it's kind of a cool document.
Any other comments, questions? Matt?
I just want to say again, and to everyone in Health and Human Service, a sincere thank you. I know, as a board, we don't often get a chance to stop and say thank you, but we do appreciate the work that everyone does for this county, and it runs the county. And thank you.
Thank you.
Board member updates or any potential agenda items that any of the board members would like to see. Good morning.
So this is maybe for you, Amber, and if this is a bad ask, you can just say we can't do that. So I missed the last meeting. I'm sorry about that, everybody. But in there was a comment, I think it might have been Rich, who had said, about the Spark program in the southern part of the county. And I'm curious, if we can break down where money is spent within the county, it'd be neat to see sort of town by town. I don't know, and maybe that granular sort of per capita data doesn't exist, but as I read those minutes, I thought, yeah, that's a good question. And yeah, often that data is surprising or not surprising, but yeah, just knowing we have this giant county and a population sort of concentrated in this northern city, but half the population isn't in this northern city. So I don't know if that's, again, not to make a lot of work for anybody, but if that exists where you could, break that down at all, I'd love to see something like that.
Do you mean overall or just the Spark program?
No, I mean, I was thinking overall, again, for this, Health and Human Services, because there are certainly programs that, are just in this place or just in that place. And some of that is obviously the density of population or where an office is located or a need for something exists, but I just wasn't sure. And again, that data may not exist. So no one should spend a lot of hours on that. But if this is one of these, you push a button and it maps out the county by township, I would find that really fascinating to see just where our expenditures are, Health and Human Services relative to where the population is.
So she could overlay that on the GIS systems.
Well, again, and I don't know, again, what data exists and what doesn't, but often I'm looking through these packets and this data is just incredible. This is the number of people on Badger Care in Ashland County. It's down to the person. And we know that all the time, and how many people are going to fall off when this emergency ends. And so I just wasn't sure what detail we have for location within the county, but I thought it was a good question, and it'd be neat to see and to say to various parts of the county, we are actually spending per capita about the same for services that, because as the heating thing comes up, some of that may be more of a rural issue than an urban issue. I don't know. So I was just, kind of curious.
Yeah.
What that breakdown actually looks like. So, and again, I don't mean to make extra work, but I was
gonna
curious.
say if we have a rough calculation as far as how much is spent per person, and I'm just gonna round numbers for ease of math, just to make the example of it. So breaking down, kind of rounding, the population of the city of Ashland is roughly 10,000. Bad River is roughly 2,000. So that takes you to 12,000 total in that small area. Of the total population of Ashland County, depending on which information you look at, you're looking at 15,500 to 16,000 people. So 12,000 of them are sitting on the very northern end. So you have roughly 3,000 spread between the bottom portion minus the 200 to 300 that live on the island. So it's, I mean, it really is staggering
Mhm.
for where the population center sits in Ashland County. It really, I mean, it's a staggering difference as far as, per capita, how it's going to break down. So.
I have a comment about the Spark program. There's two other school districts, there's Malvern and Butternut. And so everything is in the Ashland, and they don't even consider Malvern and Butternut school district for any kind of activities for kids. They just got what, $575,000 grant? You think they would be able
We
to
did,
start a program down
no,
in
we
two
did not get
schools?
that grant. The school districts got that grant.
But it came through the Spark program, right?
No,
No.
it was through the
Oh,
Ashland.
the Ashland,
Ashland
okay.
And it's my understanding that Mellon received a similar grant as well as,
The Butternut,
I think, Shawamigan.
Schwamigan? Oh, Schwamigan, got it.
Yeah,
Oh, they're
so
in
they
Price County, but.
each received a very similar grant for those specific services.
Okay, but I mean, still, why can't something be done with the other school districts going through the Spark program instead of having everything up here? I mean,
It was logistics. We did reach out to Mellon and the other schools originally, and Matt was in those meetings.
Yeah, I was waiting, but that's exactly what happened is when this initially started, it started out of this group.
yeah,
And the offer was made to all the school districts in the county. And quite honestly, Mellon and Glidden / Park Falls at that time thanked us and said no. They didn't see an interest in it at that point. We proceeded with the understanding at some point, if we could show that this was successful,
yeah,
that we would satellite it out. And, that's still the intention. And nobody
It is.
is trying to deny anybody in the southern part of the county. It's just logistically, it was easier for us to get it started up here, especially when they said they didn't want any involvement with it. And initially, the first batch of kids, if you will, were actually kids out of the criminal justice system. And,
oh,
it was directed by court order for them to participate in something. So we received some grant funding from that.
The youth wellness grant.
Yeah.
Yeah.
So, that the seed money kind of came from up here, and I think if Mellon and Glidden, whoever has an
Yeah,
interest, they should reach out. And if there's something we could do, I can't believe anybody in this room would be against,
No. And Scott,
including it.
and Scott has said that he does want to do that. So he's gonna do some outreach again.
oh, okay,
And I
cause
know-
that'd be like, I mean, they can do a simple thing like taking them hiking one day, like a Saturday or something. I mean, anything in a different school districts instead of, not having anything at all.
I think, Rich, one of the biggest obstacles is the transportation of kids afterwards. And, it's an issue up here as well, and there's been a learning process that, when you start taking them home, now you're considered a bus.
Yeah,
And, there's some different issues there that we encountered with this program that, so that would be the thing is if Mellon, I don't know, does Mellon have their own school buses or?
oh, yeah.
Okay,
Yeah.
so the key would be is how would they assist as far as, we had the Bart, and Bart goes down there now, maybe they can help too, but.
Yeah, Barclay too, yeah,
Initially, they've helped quite a bit as far as the transportation afterwards.
okay,
Some of it was to get them from the school to the Breading Center where it initially started. And, then afterwards get them home.
okay,
So that would be something, maybe you could talk to the school down there and see.
yeah, cause
Yeah,
the
they-
school would have like a day at a gym or, a couple days at a gym or something, or some hours where kids could go, and stuff.
Yeah, and I don't mean to, if you already know, but part of the process is to help them with their homework too.
Okay.
And do those things. It's not just, hey, let's play.
Yeah,
Let's have, part of it initially is let's have some food, to keep them charged up. And then let's get your schoolwork where it should be. And then let's, be
Then we can
involved in
have
an
fun.
interest.
I think maybe part of, specifically Mellon saying, I think we're good, is Mellon's got a great after-school
they
program
do a
already.
half-hour program, yeah.
Yeah, and I know the kids love it, and it's very popular.
Yeah.
So I think that might have been part of their, nah, we're good.
Yeah, and if
So-
I could touch on that a little bit more too, on that grant that they just got, they do have a great before and after school program. And now they're expanding it. They just started with this new grant that they just received, it's similar but different than what the Ashland School District got. They have a middle school and high school after school program. So also homework, keeping kids on track, but also doing fun activities, their snacks and going outside. And then it's going to carry over into getting them outside and doing some of the exact activities you talked about. We just hired a coordinator there and they are going to be, hiking, and it goes into the summer. So this grant is, they got a good chunk of money to spend, and they're definitely using it and have great plans. So I think Malin would still probably want to stick with what they got because they did just get this grant and they are doing a lot right at the school and in the area. And also going to transfer out and do some things away from the school. So I think there's a good plan, but definitely we can reach out and we can talk to Rhonda and I could help be a good middleman, being on the school board and parent and here, you know what I mean? Like, it definitely help with that if you want to talk to me about that sometime, Rich.
Yeah, okay, yeah, but now that you talked about it, it sounds pretty good though. I mean, you're
Yeah.
doing a lot, so that's all I worry about, just for the kids,
Mhm.
so.
Yeah.
No,
and
for sure.
Scott would be more than willing to share,
Yeah.
lessons learned and what's worked and,
Mhm.
so you can kind of not have that painful starting learning experience. And learn from our mistakes and what, yeah.
And those lessons come in batches, it seems.
Yeah, it does.
Back on.
Any other comments from board members? Any other business? If not, since we completed our agenda, we can adjourn the meeting.
This is Laura
Motion made.
Cruz. I move to adjourn.
Motion made and seconded to adjourn. All in favor?
Aye.
Opposed? Motion carries.